Hello, and welcome to the webinar, Promoting Student Mental Health at Community Colleges, hosted by Active Minds. My name is Laura Horn. I'm the chapter manager at Active Minds, and I will serve as the moderator for today's webinar. All participants are currently in the listen-only mode. We would like to hear from you and include your voice in the conversation, so please ask questions and share comments using the Q&A button in the top left corner of your screen at any time during the webinar. As time allows, at the end of the presentation, we will have a question and answer period to discuss the questions that have been submitted. Today's presentation is being recorded, and the recording will be shared in a follow-up email to all participants. We are fortunate to have a number of speakers sharing their work with us today. Dr. Daniel Eisenberg and Sarah Ketchen-Lipson from the Healthy Minds Network will provide new findings on the state of mental health on community colleges from their nationwide study. Following their presentation, Becky Pirelli, Director of Student Health at City College of San Francisco, will share best practices learned from California's statewide focus on community college mental health. Finally, Sandy Davis, CommTria School Liaison at Jefferson College, and I will present creative strategies for involving students in increasing mental health education and connectedness on community colleges. As we pull up the slides for the first presentation, I would now like to welcome and introduce our first speakers. Dr. Eisenberg is the Director of Healthy Minds Network and an Associate Professor of Health Management and Policy at the University of Michigan. His broad research goal is to improve understanding of how to invest effectively and efficiently in the mental health of young people. In recognition of his early career research in 2010, he was awarded the Thompson Prize for Young Investigators by the Association of University Programs in Health Administration. He is the program director for his department's PhD program in Health Services Organization and Policy. Sarah Ketchen-Lipson is a joint degree doctoral candidate at University of Michigan, studying health management and policy at the School of Public Health and Higher Education at the School of Education. She is also co-principal investigator of the Healthy Body Study, a comprehensive survey of eating and body image images among college and university student populations. Her research interests center around the mental health of adolescents and young adults, primarily among college student populations. She is particularly interested in epidemiological research and interventions to address eating disorders, depression, anxiety, and healthy eating. Welcome, Dr. Eisenberg and Sarah. And now I will turn it over to Dr. Eisenberg and Sarah.
Great, thanks very much. This is Sarah Lipson, and I'm going to talk for 2 minutes before turning it over to Daniel. I'm just going to set the stage a little bit for the data that we're going to present. And I'm going to start by talking a little bit about the Healthy Minds Network, which is our research to practice initiative based here at University of Michigan. So we can advance to the next slide. So this slide shows our basic research to shows our basic research to practice loop, whereby we here at University of Michigan are doing a lot of research ourselves. That's kind of our starting point for our work, is to produce knowledge and do research. And most of our research is related to college student mental health and more broadly adolescent and young adult mental health, a lot of which it comes from survey-based studies, which we're going to talk about in just a minute. So after doing all of this research, our goal is really to disseminate it in a way that diverse audiences can understand our research, can kind of to make it as accessible as possible, and then ideally for the research to inform practice and policy. So in this case, we're really hoping that disseminating the new findings we have related to college student mental health can lead us towards informing practice related to mental health on community college campuses. We can advance to the next slide. And in our broad research to practice agenda, a lot of it begins with collecting descriptive population level data. That's sort of our starting point as we think about how we can invest in the mental health and well-being of young people. We really need to kind of understand what's going on with this population and understand their needs, the things that they're kind of experiencing. And we do that through large-scale population-level surveys. And so today, that's really where we're starting with community colleges, because there's just not that much known. And so collecting descriptive population-level data is the first step before we can figure out what type of intervention might be needed, and how we can improve well-being on community college campuses. Slide, please. Let's just go one slide back, please. So there's a real need for research related to community college student mental health. There's very little known about the mental health of community college students. What we do know from a few national surveys that have been conducted is that there's a lack of mental health resources. So community college campuses in general have fewer resources than most four-year colleges, and that's true as well when we think about mental health resources. We know from the National Survey of Counseling Center Directors that the top concerns that community college students are reporting include depression, anxiety, and stress. These are very similar, of course, to the mental health concerns that we see on four-year campuses as well. But there's a kind of a lack of more nuanced data related to community college student mental health. Slide. So the data that we'll present today come from the MIND study, which is a national survey-based study that began in 2005 here at University of Michigan. And since then, we fielded the study at over 100 four-year colleges and universities across the U.S. with over 100,000 survey respondents. And we use random samples of undergraduate and graduate students at participating colleges and universities, and we invite them to participate in an online survey, the Healthy Minds study, which takes about 15 to 20 minutes. And the main measures included are, of course, mental health. We measure depression and anxiety using clinically validated screening tools such as the Patient Health Questionnaire 9 and the GAD-7. We also look at self-injury, suicidality, as well as positive mental health. So we're interested in the prevalence of mental health and also the correlates. We're interested in health behaviors such as substance use, exercise, and sleep. We also measure attitudes and knowledge about services. So do students know where to go? How do they feel about mental health services and about seeking help? And their actual service use their help-seeking behaviors, which is obviously a really important thing to try to understand, is how we can increase utilization of mental health services. And finally, we also look at the academic and social environment to try to understand what may be affecting not only students' well-being, but their health and their help-seeking behaviors. Slide, please. So one of our big goals for the Healthy Minds study beginning this past academic year was to expand to community colleges. So we knew that this was a research void, that there was not a lot of research related to community college student mental health. And from a research perspective, we were just really interested in trying to understand more about what was going on in that population. So this became a focus for us during the course of the 2013-2014 academic year. And we got funding to expand the Healthy Minds study to community colleges from the University of Michigan and also from NeoMed, which is an organization in Ohio. And today we're going to look at some data from the first 3 schools that have completed the Healthy Minds study. So we have 3 community colleges from Ohio, and we're still actively collecting data at a few more schools right now this spring. And then in the fall, we're very excited because we're going to be launching a modified version of the Healthy Minds study at about 20 community colleges across the country with funding through Full Stop USA, University of Wisconsin. We're collaborating with a faculty member, Sarah Goldrick-Rabb, the Association of Community College Trustees. And that modified version of the Healthy Minds study has a special focus on low-income students. And so we're looking at use of public services, including housing and food insecurity. And of course, how those relate to mental health and help-seeking behaviors in the community populations. Slide, please. So the data that Daniel will present today come from our 2014 community college data, and we have 3 schools from Ohio. As I mentioned, we include a random sample of students from participating colleges and universities, and so across 3 community colleges, we invited 9,121 community college students to participate in the Healthy Minds study. And we had 1,419 students who completed the Healthy Minds study for an overall response rate of about 16%. And we're going to be showing in the slides a comparison between these 3 community college, the sample from the 3 community colleges relative to our overall sample from the 2013 Healthy Minds study, which is at 4-year schools. So we had 17 schools in that sample from last year. We invited over 100,000 across the 7 schools and had over 2,100 completed the survey for an overall response rate of about 19%. And all of the findings that we're going to present are adjusted for non-response bias. And by that I mean that we collect administrative data from the registrar's offices, and then we use that to weight the responses based on those known characteristics, so gender, student level, and grade point average. Slide, please. So now I'll turn things over to Daniel, who will talk about the findings from these 3 community colleges in Ohio.
Hi, everyone. This is Daniel Eisenberg, and so we just put together some numbers from the data that we just finished collecting, as Sarah said, at these 3 community colleges in Ohio. So that's the blue bars here, and then as compared to a collection of 4-year colleges and universities from 2013. And each bar represents the percent students screening for various conditions. So for example, you can see on the left, 13.3% of community college students have a positive screen for major depression as compared to 8.9% in the 4-year schools. And I'm going to go from left to right. You can see for a number of these conditions, there is a somewhat higher prevalence of mental health problems among community college students as compared to our 4-year sample. Although for self-injury, you have a bit of a reversal there. And then overall, the rightmost bar, which is the percentage of students with any apparent mental health problem, any of the problems listed in this chart, it's actually almost equal, both around 39%. You might be wondering why, given that most of the measures are higher for community college students, how does it end up being equal all? And the answer is that, and it's not shown here, but we also looked and saw that there is a higher percentage of college students with co-occurring or multiple mental health problems. And so even though there's kind of the same percent with any mental health problem, it looks like there are a larger number of community college students with multiple problems. Next slide, please. We also included a handful of quotes. I'm not going to read them now, but I think you'll have the slides and you can look at them in more detail just to illustrate. This is in response to, there's a couple points in the survey where we invite the respondents to write in any additional comments they have. And a number of the comments from our community college sample have talked about financial stress, having family, having kids, and sort of how it can become overwhelming in combination with school. Next slide. Again, some more on the same theme. You see this first quote about having to work 45 hours a week, having a child at home, and still going to school 4 nights a week. And then the next quote about having this person's house was foreclosed, which of course is probably a fairly common event in the past for the organization. Next slide. Again, long quotes. I'll let people look at them at their leisure. But maybe just look at the first one. We picked this quote out because it gets at the idea that well, this person saying, I have a high sense of purpose, but not a clue of how to fulfill that purpose. So basically a lot of things going on in these people's lives and a lot of stressors beyond school. Next slide. Now turning to use of mental health treatment, first looking at therapy, counseling or therapy, as we refer to it in our survey. This is, in the past year, have you received counseling or therapy for your mental or emotional health? And we're restricting attention to students with an apparent need, with one of the mental health problems that we listed earlier. And you can see that the use of therapy is about the same overall for community college students in our sample as compared to 4-year. But you can also see that for every condition listed here, it's well under 50% with an apparent need who have used any therapy in the past year. Next slide. Okay, this slide, it looks like you had a little with this slide, but I can tell you the numbers. We're missing the blue bars in this slide, but actually the numbers are higher for community college students than the gray bars for the 4-year students. That was a bit surprising to us. It's important to keep in mind this is just 3 community colleges in one state, and probably is not representative of community colleges nationwide. We'll get a better picture of that next fall when we look at 20-some schools, 20-some community colleges. But actually the use of psychiatric medication is a bit higher in our community college sample. And we'll get you the corrected slides as well. Next slide. Okay, so now when you combine, if you can go back one, please. Thanks. If you combine the medication therapy and look at what % of students received any treatment, meaning at least one of those 2 modalities, what % out of students. So looking, for example, at major depression, students with a positive screen for major depression on the left, 56.6% of community college students have received some mental health treatment as compared to 49.5% among 4-year students. And if you just scan this chart from left to right, you can see actually the use of treatment to our surprise, is somewhat higher among community college students. And that difference, the fact that it's higher, is accounted for higher use of medication. But one thing we also looked at is we thought, okay, this probably has to do, in part at least, with age. And I think Sarah showed that the age distribution. Or actually, we didn't show it, but it's about 40% of community college students in our sample who are traditional college age, 18 to 22, as compared to over 70% from our four-year schools. So basically, community college students, as you know, are a lot of them are a lot older than the traditional college age. And we know from our other work that as people get older, past adolescence, their likelihood of using mental health services does go up. So that largely accounts for this difference. If you account for age, the use of treatment is about the same per community college sample as four-year schools, which is still a bit surprising. But it's interesting to note that the medication use is higher and the therapy use is actually somewhat lower for a community college sample as compared to four-year once you adjust for age. Next slide. Just a couple more quotes that we threw in here. One student saying that taking the survey inspired them to seek information at their campus, and then another noting that mental health is a troubling subject for many more students than it appears, and encouraging access to counseling. Next slide, please. So what we're hoping will be done with these data, and these are very preliminary numbers that we're showing, but as we clean it up and provide nice reports to the schools and data sets, and also make them the aggregate data without the school identifiers widely available to anyone who wants to look at it, we're hoping that for the community college population, this will help quantify the problems, so quantify the prevalence of various mental health conditions, the gap between use of treatment and the prevalence of the problems, and identify opportunities for improving mental health and public health in these populations. A lot of the schools also sometimes use the data to evaluate their programs, especially if they collect the data in multiple years. They might see how things have changed pre and post a major initiative in their population. And also a lot of schools have used this kind of data to advocate for resources. In some cases, they advocate to their higher administrators or their provost or their president, pointing out the needs for mental health services and programs and some of the gaps. And also we've helped some schools translate some of the data into an economic case related to student retention and tuition. Next slide, please. As Sarah mentioned, in the fall we'll field a modified version of our survey at about 20 schools in partnership with Sarah Goldrick Rab and Single Stop and ACCT. And that data will allow us to look at a whole other set of issues related to mental health, like food insecurity, housing insecurity, financial stress in general, use of supportive services and public benefits, and how all this relates as well to academic outcomes. As you probably know, the retention rate or the persistence rate in college is already pretty low at four-year schools, and when you look at two-year schools, they're even lower. And we're also hoping to move more into intervention research for these populations, try to actually develop and evaluate programs that could be helpful. Next slide, please. So here's our contact information. We're always looking for more partners in our work, and whether you're at a two-year school or four-year school, or if you're not, any kind of organization interested in these populations, we would love to work with you or talk with you. So you can see our emails and our website. Thanks so much for having us on here, Laura.
Thank you. We are having a little bit of issues with the audio, And so I'm going to ask all of our speakers to please go ahead and press *6 to unmute your line, and hopefully that will fix the audio issue. We're going to go ahead and move on with our next presentation. As a reminder to participants, as you have questions for our speakers, please type them using the Q&A button in the top left corner of your screen, and we will address them during the Q&A portion at the end of the webinar. Our next speaker, Becky Pirelli, has recently become the Director of Student Health at City College of San Francisco. After serving 14 years as Director of Health Services at West Valley College. She was instrumental in obtaining a Cal Mesa campus-based grant promoting an all-college approach in support of student mental health at West Valley, and now participates in the CCSF Crisis Management Team building similar efforts. She is an active member of the Health Services Association of California Community Colleges as part of the Research Committee and as representative to the Chancellor's Office Advisory Group on Student Mental Health. Welcome, Becky.
Thank you. I'm pleased to be able to share information specific to the California Community Colleges, and hopefully much of this information is transferable and adaptable to not only other community colleges, but four-year institutions as well. So if I can have the next slide, please. So to give you an overview of the California Community Colleges Student Mental Health Program, this looks like a lot, and it actually is. There are four major components of funding that came from a consortium of mental health, behavioral health directors throughout the county, which has become Cal Mesa. And much of the funding is now dispersed to higher ed entities to create building capacity and really doing early prevention and intervention. Next slide, please. So the major four components really have a goal to build capacity and concurrently, as we're doing prevention, early intervention, we're doing peer-to-peer, we're really encouraging peer-to-peer support of students working with other students. A major component is fostering partnerships and collaborations with not just internal stakeholders in the colleges, but also external partners in the community, public and private. We're definitely supporting underserved students. Faculty and staff training is a huge component, as is the training of students, and suicide prevention. Next slide, please. Of the four components of the Student Mental Health Program, one of the major components is education, training, and resource development through a statewide training and technical assistance contract. The other three components, which I'll mention here, are suicide prevention training, which is a very specific large component of the mental health program. Campus-based grants is a component, and program evaluation. So as we're looking at the training and education component, we have, next slide please. There are very college-specific outreach that's done by the technical and training contractor, and the capacity building and systems and infrastructure is one of the major things that's happening in terms of trying to get public, particularly county mental health and county behavioral health, to work with the California community colleges. Many trainings have been done. Archived webinars are available, and we'll talk in a minute about the resource repository. But one of the recent webinars that we did, for an example, was the Columbia Suicide Severity Rating Scale by Dr. Kelly Posner. Many of these regional webinars are open to county public health as well as consortia of colleges, not just community colleges, and in a minute we'll talk about the size of the system, but the other colleges and universities. And the resource development and product development is another thing that's being worked on in terms of creating sustainability. Next slide, please. Some of our partners these are some of the major partners that you see here that look familiar to you. Active Minds, I know we're going to hear more detail about that. NAMI, National Alliance on Mental Illness, Foundation, Young Invincibles has been a great partner recently in terms of the Affordable Care Act. Sigma is specific to threat assessment, and SafeZone and Gay Alliance in terms of being able to greet our underrepresented bisexual, transgender, LGBTQ populations, and of course the SPRC, Suicide Prevention Resource Center. I do want to say that these are just a few of the major partners, and the objective again is to build collaborations, and this is definitely happening. We see the major ones here, but there are many, many, many collaborations going on that are at the local level and the regional level, again, with public institutions, health, mental health, education institutions, as well as community-based organizations. Okay, next slide, please. One thing that I'm very excited about, as are my peers in the California community colleges, is that we now have a resource repository. And early on in the planning for these student mental health monies, the three public higher education entities, the Universities of California, the California State Universities, and the California Community Colleges, did get together and discussed what might the end result of sustainability look like in terms of public higher education. And we all agreed that having an online database, sort of a resource clearinghouse, would be valuable for all. And I'm pleased to see that we have this resource available. Next slide, please. So of the four big components of the student mental health program, one of them is a big concentration on specific suicide prevention training. And Cognito happens to be the sole contractor for suicide prevention training. However, there are multiple efforts and activities in addition to using the Cognito modules, which I'll talk about in a minute. But other things that are being implemented for suicide prevention are the QPR, Question, Persuade, Refer, which most of you are probably aware of, and the, as I mentioned, the Columbia Suicide Severity Rating Scale, National Depression Partnership. Many of us had started with the NYU group through American College Health Association to get started in the early identification process to, again, create elements of suicide prevention. Next slide, please. So looking at the specifics of Cognito, Cognito is online interactive gatekeeper training simulations, and what you're seeing here are icons for all 6 modules, 3 of which are faculty, staff, administrator-focused trainings, and the other 3 are student-focused trainings. And it's worked well. The success of this is that it's very easily accessible, and because of the grant, it has made it very cost-effective for those community colleges with very little resources, which Dr. Eisenberg mentioned in terms of less resources. It's been very helpful to be able to address all college, all students with this medium, especially because it's accessible anytime anybody wants to sit down at a computer. Also, you can go in on it and leave the training as you're in the middle of the training so that you can go back to it. So again, easily accessible for everyone. Cognito is included on the Suicide Prevention Resource Center's Best Practices Registry, and we hope that at the end of the cycle of funding for the Student Mental Health Program, which happens at the end of this year, we hope to have discounted rates for at least another, actually we're going to have free access for a couple of years and then have a discounted rate after that, which is very helpful in terms of capacity. Next slide, please. So in terms of the California Community College system, faculty and staff, 6,633 people have been trained in terms of faculty and staff. I would say that since this slide was created, there are probably many more, especially because of the time of year and the ability to get some of the data back from the training modules. Students trained over 10,000, and again, in terms of the peer-to-peer effort, this is something that's very exciting, and that students have actually been the major stakeholders to spread the word that these trainings have been very helpful to them. I do want to say that of the participants, there are 112 community colleges, and 82 of the colleges have actively accessed the trainings and have reached 43 counties statewide. And for those of you who don't know, California has 53 counties, so 43 counties is a pretty good spread. And hopefully in the next few months we'll be able to even get farther out there. Next slide, please. The success of these trainings has been based on several different things that we've seen happen, and we know that where there is administrative and departmental support, I wouldn't consider it mandate, because anyone in community colleges, especially in California, knows that we can't really require people to do anything, but we can highly encourage and really continue to create champions and support champions to create stakeholder support throughout the culture. And when marketing is in place, in person in the classroom, emails, websites, Facebook is another really good medium that people have used, and Twitter as well. And that when there is provision of opportunity, and I think the repetition of these opportunities has been seen as something very successful, is that continuing to go back and being persistent and patient is really important. And that incentives and opportunities can be created naturally because there are natural opportunities given the cases of students of concern that come up. And when we actually can use cases and discuss them, the opportunity to say, hey, have you been able to check out the online trainings that are available, and point out the specific training that may be veteran specific or LGBTQ specific, has been very successful. Next slide, please. In terms of the campus-based grants, there are several different things about the campus-based grants that are ongoing at the same time. We're trying to create an informed campus, create sustainable referral networks, do prevention and early intervention, which of course is the hub of everything that we're doing. And as all of these activities and events are happening concurrently, we're building capacity. And one of the things I'll mention here, in light of the data shared by University of Michigan, we, part of the requirement of the campus-based grantees was to participate in the National College Health Assessment. And during spring 2013, there were actually 24 California community colleges, which we've kind of referenced as a consortium of data, actually did implement the National College Health Assessment. And we have just received the data back. It's almost been a year, but we're very excited to have it. And I know in terms of collaborations, we will want to have some ideas from Dr. Eisenberg and his crew in terms of how to analyze this huge set of data on 17,000 California community college students. Next slide, please. So California community colleges, there are 23 grantees representing 30 colleges, and the reason why it looks that way is because there are several consortia of colleges that got grants as a consortium group of colleges. so individual and consortia groups. And you'll see the highlighted areas are where they've been spread out around the state. Next slide, please. So creating an informed campus, creating sustainability, building capacity, doing prevention, early intervention. Many, many things are happening at the same time, and some of the most creative things have happened. The icons here you'll see, the Cuesta College, a small Central Coast college, created a video that's very customized to their campus in terms of a teaching tool for students, faculty, and staff to educate them better about student mental health and the services, specific services on the campus. Rio Hondo also has a readily accessible app specific to resources available to students, as has Wellness Matters, which is the State Center's Community College District, which is one of the consortia groups. And the Send Silence Packing, 6 colleges hosted the Send Silence Packing Tour last year, 6 of the California community colleges, and some of our sister California state universities and UCs have also hosted it, and we've been able to capitalize on one another's Active Minds Send Silence Packing tours. And I must say that having hosted that at the West Valley College, it is definitely a huge impact on a college or university campus, because you cannot go by it without seeing it and asking questions. And I know we'll hear more about that. One of the things, too, in terms of a creative way to create, again, collaborations as well as destigmatizing mental illness and mental health issues, is one of the campuses collaborated with NAMI and got a kiosk called with information called Mental Health Matters, and collaboration on the part of NAMI and the college to actually have the kiosk placed in a highly utilized area on the college campus. Again, helps people to understand mental illness and mental health on their own terms, looking at a kiosk that's readily accessible to them. San Diego City College was recently recognized as a first higher ed institution in San Diego County as a Live Well campus, and I want to emphasize here that I think health and wellness in general has been the venue and the medium with which many of these colleges have used to put mental health matters out there, which I think is, again, becoming standard of practice in terms of public health and mental health. Next slide, please. Developing sustainable referral network. As many of you know, this is a very challenging thing given the lack of resources that many of us have, including the public health sector. And one very good example that you see here is that the LA Community College District worked very hard to get all of their campuses together to train to develop a behavioral intervention team. And I might add that many of the colleges have developed tracking system and tools for campus threat assessment, and some have even purchased online tracking tools, like Maxim is one of them. I think those colleges that prior to the mental health funding might have had a behavioral intervention team or an assessment kind of body on their campus, but have been able to really thoroughly develop and grow and continue to grow. And these are being developed and have increased in terms of numbers and possibilities. Next slide, please. So multiple aspects of prevention and early intervention are being implemented. One of the strategic directions, of course, on the state level is to reduce stigma and discrimination, and it's, definitely a national effort as well. But part of what's been really successful is something that developed within Riverside City, in that students have very much come together to create peer-to-peer efforts and supporting one another. And due to one of the students who has been very active as a mental health ambassador, has created a statewide Student Mental Health Advisory Council, and they will be taking this idea and initiative to the next Student Senate meeting of the California Community College Student Senate when they meet again very shortly. In terms of doing wellness efforts and strengths-based approach, San Bernardino Valley College, several other colleges have developed very strong collaborations with their county mental health as well as their nearby universities of California and California State Universities, and really have aligned a lot of their work with student engagement and success, which is one of the major thrusts of the California community colleges at this point. But part of what's increased between the first year of the grant and this year, colleges have increased providing therapy and increased providing mental health intern programs. Next slide, please. In terms of building capacity, advisory groups have been formed, again, across institutions. And in terms of expanding participation, there have been, utilizing the training and technical assistance, we've been able to do regional trainings to invite as many stakeholders in the areas as possible. Part of what we've been able to do as well is really disseminate many of the informational pearls that we've received from one another, and assisted the county and community in terms of disseminating information as well. So it's been wonderful cross-pollination. Next slide, please. And most of these things you will be able to see in the resource hub at the cccstudentmentalhealth.org website. In terms of program evaluation, again, this is the fourth component of the student mental health program, and there has been an increased trends of increasing reports of a lot of progress, nearly completion of certain kinds of issues that people have taken on to do as the grantees. Next slide, please. So what you see here is a list of different kinds of initiatives that people have taken on, and what you see, the blue line is the initial survey that was done of the campus-based grantees in terms of where they were in their progress of these different things, in terms of increasing peer-to-peer opportunities all the way down to developing resources. So you've noticed that there's been an increase in everything with here. Next slide, please. And again, because we're early on in getting, and it takes years to do a lot of these initiatives for one, but those of us who collect data, we also realize that it takes a while to get results. And again, we're almost at the end of year 2 of the student mental health program. So part of what we have seen over time is that with post-training satisfaction surveys, there has been a perception that there is an increase in skills and behaviors related to identifying students in distress, having an increase in comfort level, and definitely awareness of warning signs. So there have been improvements in this. And again, I think most of us would love to see this go on for at least another year to be able to see some specific data on this. Next slide, please. And I want to wrap it up pretty soon, but what is working is that there has, this actually shows you what has been resulted from the Cognito surveys. Cognito has survey, pre and post surveys, and what faculty and students tell us, faculty, staff, and students tell us, is that they have reported in surveys that they have increased their referral behaviors. Next slide, please. And again, what's working is that people are encouraging students to get help, and that many stakeholders are taking responsibility to actually act on what they're hearing and seeing. Next slide, please. Okay, there has been a great increase in these developing policies, trainings, and awareness. And next slide. It is challenging, and I think given our academic calendar and especially in terms of creating community collaborations, that there are many, many competing priorities that people have to deal with. Next slide, please. And again, Active Minds and the Send Silence Packing has had huge impact on thousands of people around the country, but I think in the California colleges, because of the gift of having been able to host these throughout the state, it's been really good. And I'll finish up by saying, staying the course. Again, the next slide. Leveraging resources takes being patient and persistent, and that there are certain definitions of student success in the California community colleges, and that to link a lot of what we're doing with student engagement and getting them to where they need to go is really part of our charge. And it's very, very exciting and overwhelming too. So thank you very much.
Thank you, Becky. For our final segment, I would like to first give a brief overview of Active Minds as a strategy for student mental health on community colleges, and then turn it over to our final speaker, Sandy Davis, to discuss the role of Active Minds at Jefferson College. As chapter manager at Active Minds, I develop and support Active Minds chapters on college and high school campuses. Prior to coming to Active Minds, I supported multi-sector community coalitions across the country to implement nutrition, physical activity, and tobacco prevention initiatives at the National Association of County and City Health Officials. Sandy Davis is a licensed professional counselor. Currently, her position is school liaison for CompTria in Jefferson County, where she provides therapy, community outreach, and presentations to schools. Sandy is a certified youth mental health first aid and QPR trainer and utilizes narrative and solution-focused therapy with her clients as shared in Counseling Today, The Power of Story. She is also an approved LPC supervisor, a participant of the ACCA Community College Task Force, a member of the ACA and ACCA, and was a juror for the National Short Film Competition on Mental Health, Art with Impact. At Jefferson College, Sandy is a counselor for more than 5,500 students on 2 campuses, a member of their BCT, and also an advisor for the campus student organization Active Minds. Active Minds was created by our founder and executive director, Allison Malman, following the suicide of her only sibling, 22-year-old Brian. Seeking to combat the stigma that had caused her brother to suffer in silence and ultimately take his own life, she created a group on her campus at the University of Pennsylvania that promoted an open, enlightened dialogue around the issues. In 2003, she created the 501c3 organization Active Minds, Inc. to address the true scope of student mental health by creating an environment that fosters open dialogue about mental health through awareness and education of students. Today, we have more than 400 student-run chapters in 47 states across the United States, including 35 community college chapters. Active Minds takes the approach of working directly with students to address mental health on college campuses. We provide students with education, leadership opportunities, and advocacy training, and empower them to encourage help seeking among their peers and to end the silence around mental health. Through our work, we also strive to promote dialogue about mental health, remove the stigma that keeps students from seeking the help they need, create environments that encourage students to speak up about mental health and to seek help, and to create a national movement for changing the conversation about student mental health. Active Minds chapters are recognized student groups on campuses that serve as a bridge between students and the mental health provider community, both on and off campus. Through the use of Active Minds programming and through their own innovative ideas, chapters bring awareness to mental health and refer students to counseling services for support. Our chapters do not provide peer support groups or clinical advice, but any student can get involved, whether they have personal experience with mental health disorders or not. There are a number of resources the National Office provides chapters to get started. We provide educational materials about mental health that are customizable to also include information about where students can find help on their specific campus. We have full-time staff dedicated to answering questions and providing best practices for students. And we also provide a host of national programs that students can bring to their campuses. Since Active Minds was founded, the organization has made a huge impact in the college and mental health community. We are currently preparing for our 11th Active Minds National Mental Health on Campus Conference this fall. It is the only national conference addressing college student mental health and young adult advocacy, bringing together 600 student leaders, change agents, and experts from across the country to educate, energize, and inspire the next generation of mental health advocates each year. Sin Silence Packing, as Becky mentioned, is our suicide awareness program carrying over 1,100 backpacks to represent the number of college students who die by suicide every year. This exhibit has made its way to more than 55 locations across the country and has reached thousands of individuals in the communities where it stops. The Active Minds Speakers Bureau is a group of young adult public speakers who are extensively trained by the top mental health professionals and coaches in the country who speak to students, staff, and faculty about their own personal struggles with mental health. We also offer awareness campaign kits to our chapters to recognize Stress Less Week, National Eating Disorders Awareness Week, and our own nationwide Day of Acknowledgement, National Day Without Stigma. It's easy for a school to start a chapter. Interested students and your staff complete an interest form online and receive immediate support from our national office to start developing the chapter. Each chapter needs a faculty or staff advisor and at least 3 student leaders to get started. Once the group becomes a registered student organization on campus and completes our registration packet, we invite the students to attend a new leader webinar and they become an official chapter within our network. Most often, students report they enjoy being involved with their Active Minds chapter because it gives them an avenue to share their passion for mental health and to make a difference in a better world. Many of them have had personal experience with mental health disorders or have a loved one who has experience, but Active Minds chapters are open to everyone. Despite the challenges of addressing student mental health, particularly at a community college, the community colleges in our network often say that Active Minds help refer students to counseling services, raise awareness of mental health and the services available to students for getting help, and to continue the conversation about mental health on campus. For more information about Active Minds, please visit our website at activeminds.org or email us at chapters@activeminds.org. And now, for an example of how Active Minds works at a community college, I will turn it over to our final speaker, Sandy Davis. Welcome, Sandy.
Thank you very much. So I'm Sandy Davis. I am the Active Minds, one of the Active Minds advisors here at Jefferson College, and I provide mental health counseling to students here. I am a school liaison, which means I go to a couple of other schools as well. But I spend 32 hours a week at Jefferson College. Next, please. Next slide, please. We started off with a bang at our Club Resource Day. This is a way for all the clubs to introduce themselves to the new freshman class. And so it was a beautiful day. We were trying to find out some ways to get people engaged right off the bat, because we know statistically if we can get students engaged within the first 6 weeks, that they're more likely to finish that semester. They're more likely to have the resources that they need to achieve success, and they're more apt to reach out for help when they need it. And so this is our president, Alicia Thomason, and our Viking. They're in our ball pit that we made, and we we had some questions in there, how to make a friend, and we had several students that were engaged in that. It was a fun time. Next slide, please. On community college campuses, we have to be a little more creative. We don't have the budgets that some of the universities have, so we tend to borrow, I guess would be a nice word, ideas. And we found this one on Soul Pancake. And what it was, they had a huge ball pit, and they had questions in the ball pit, and they would ask strangers to get into the ball pit and ask each other questions. And so we even outdid ourselves by putting 3 in our ball pit. And it was just, again, it was a fun time for people to kind of talk and get to know each other and make some connections that first week of school. Next slide, please. One of the ways we did introduce the mission of our club was to have World Suicide Prevention Day. And we asked students and staff and faculty to submit stories about people they had lost to suicide. And so we had an art installation. We had stories attached to shoes where people could stop and read them. Megan Meyer is a student at one of the local schools that completed suicide after a bullying incident, and we contacted Tina Meyer, her mother, for permission to use her story, and Tina was very kind in letting us do so. So this is Megan's story, and it was leading you to our art installation. Next slide, please. And it was a very warm day. I think it was about 98 degrees. And so we had students take shifts where they would sit out for a couple of hours as their schedules permitted. You can see the information that we had available. We take our trifold everywhere. We give out lifesavers or hugs. On really hot days, hugs are not a good idea, just for future reference. So we used the lifesavers. We had our water bottles back there. If you see to the right, that tree, well, this tree was found on the side of the road, and it accompanies me to many of our events. We use it to allow students to use their voice about what mental health means to them. On this particular day, the blue sheets were reasons to survive, reasons to not complete suicide, reasons to live, and so we just kind of let students put down what they felt represented that for them. And you'll also see the very right there, we had little stress kits. The noodles that you put in your pool with your kids were for you. We sliced them about an inch thick, and that was our stress ball. We threw a mint in there as a commitment, and we put a little piece of information in there about what Active Minds means. And so that was our intro to the community. Next slide, please. And one of the things we do is chalk the sidewalks. It's very cheap. It's very cost effective. We have a lot of help. The art club has been wonderful as providing some of the inspiration and the things that they've written down. Our students as well get involved. They get certain sayings that they're allowed to put down and given kind of carte blanche as far as what kind of figures they want to put down, what kind of how they want to do it. We want to get that message out there, though, that there's help available. And I thought the students did a really nice job on this one. Next. And like I said before, this is one of our found treasures. We play the Kevin Bacon game, and that is what you see in the construction links. And what the Kevin Bacon is that it's based on a Hollywood version of every actor is connected to Kevin Bacon within 6 people. And there's also the theory of 6, where the whole world is connected by 6 people. So we figured if we could connect to everyone in the world, that we should be able to connect to ourselves here at Jefferson College. And so we started this link chain where we picked a couple of core people, Deb Shores, one of our advisors being one, and we connected people to Deb. And we have a lot of links on this, and people could see, oh, I do know that person. Oh, I know that person too. Or maybe we would introduce them right then and there, but they could then put their links together, and maybe they make a new friend. Next. And I'm sure some of the people saw on our advertisement, what does the number 6 and zombies and balloons have to do with mental health? Well, how do you deal with anxiety? Okay, we decided to partner with the Legion of Gamers and have people talk about anxiety, because we do go to these scary movies. We like to be scared. But if someone says pop quiz, that's not the scared that we enjoy. So we wanted to provide some information about how to deal with that effectively. And so we partnered with them and did a human versus zombie game. And we based it on the CDC website. We used their scary poster, and we wanted the people to get ready for any kind of disaster. And so we made kits based on the 1, 2, 3 to make a kit, have a plan, and know how to get a hold of your family, and what to do in case of any kind of disaster, such as earthquakes or tornadoes or flooding. You know, what to do. What do you need to have in place? And the human versus zombie game just made it a fun activity. The kids got together. They dressed in zombie costumes. They did zombie makeup. They had a great time. And we got our message out there, and it got a lot of attention from the community college, as you can well imagine. As you walk by, it's hard to not see these guys dressed up. And so they would come over and they would ask about questions. We had another opportunity to give out information about Active Minds. Next. And here's some more budget-friendly ideas. We're also lucky in Missouri that we have a group called Partners in Prevention, and they provide Ask, Listen, Refer. It's a suicide prevention training online program where you can go online, you take the training, and you can make it specific to your college or university. And they provide free magnets and pens and highlighters and sticky notes. And we use those as giveaways at our events as well. And we were able to increase our trainings by about 70 people this year as we partnered with Student Activities. They have a new program called Are You OK? And we partnered with them every month about a different mental health subject, such as alcohol or suicide, relationships. And then the Valentines on the right corner, they're just little baggies, had one piece of candy. You know, all that stuff that you put through your shredder? Well, we put some in there. Maintenance not too happy about that, so we put less in the next year. But we gave out over 650 of these this year to 2 campuses. And so everyone got a little Valentine that we were able to meet that day. And ComTree has a new therapy program. We have therapy dogs, and they come to our Stress Fest now. And so this was our fall Stress Fest where we brought the dog in, and there was a line to see the dog. So obviously that is a need that we need to somehow figure on how to meet, because one dog was not enough. So hopefully as that program grows at ComTree, we will be able to increase that. And on the right corner is our Veterans Day tree. That's our tree again. And we made 165 red poppies, which is one of the emblems of veterans, to represent the 165 students that are receiving veterans benefits here at the college. And it was our way of acknowledging them. Next. And here are some other things we've been doing. Our trifold display, it's just one of those that you get at Target or Walmart or any other place like that where you can just buy one for your kids at school, and we just use it and put different things on there. The Back to School Fair before school started was our way of introducing Active Minds to the community. We made those 500 de-stress kits that included the little noodle and a little piece of candy and some information on Active Minds. But because we know that some of these students' parents, they may be thinking about going to college, and if they know there's someone there that's going to be supportive, maybe that's just the edge they need. So we made sure that we were at this fair, and this is Alicia with the Cardinals Fredbird. And then on the bottom left there is Will Roman. He is our marketing and public relations man, and he is with one of our Hope for You winners. And Hope for You is something that we started this year. We've been talking about how to reach people and this idea that we all need 6 people. If we're already connected by 6, why isn't that a good number to kind of encourage people to have? So we started asking that question, who are your 6 people? And to get that marketed, we used lunch on either the 6th of the month or the 11th of the month. And at 11 o'clock, whoever made it to the cashier at 11 o'clock exactly, we paid up to $6 for their meal. And everyone was there. They saw what was going on, and we provided some information on Active Minds and encouraged everybody to know who their 6 are, either in good times or bad times. We still need people to celebrate with, and we still need people to cry with. And the Veterans Gift on the top left there, we asked them to come to one of our film screenings, and they provided the empty chair ceremony beforehand, and very moving program. If you have not seen it, I would encourage you to have that come to your campus. It's a way to really understand what's going on with our military, to get them involved with your campus, to show that they are important. And in response, they actually gave me the little red poppy there you see, and the POWMIA, and then one of the gentlemen, he gave me his Korean War button there. And it was overwhelming that they felt so wonderful about coming to us that they would give me a gift. So I thank them very much for that. Next. And this is our Stomp Out Stigma, where we have a wonderful time filling the balloons up and providing information. The kids really get a kick out of it. Our nursing manager allowed the nursing classes to come out and do this with us. So we had quite the crowd, and it was a wonderful time. And people were able to go away with some information about the free counseling here on campus, some information about ComTree being a new federally qualified health center where we provide not only mental health services, but we're providing health services and dental services to our community. And students do not have to have insurance. The co-pays are very low because they have this federal grant. Next. And so Shocktober is one of our community outreach events. We open the college and invite kids to come in, and we have little games and a fun time. There's a DJ that plays music, and this is one of our little fundraisers that we do. But generally it's we receive enough money to cover the cost of our event. So at our particular one, we did cookie decorating, and we did a couple of games, and we gave away tire gauges to the parents. Again, we want to reach out to the parents that are bringing these children in, because again, if they know there's support here, maybe they'll come back to school. Next. And Operation Beautiful was in February, and we asked people to write one thing that they liked about themselves. And that is Will, and that is myself there, and we were really shocked that some people had such a hard time saying something nice about themselves. And so we went a step further and we made the sticky notes that you see on our bulletin board there. They went on the mirrors in the bathrooms at the Hillsborough campus and the Arnold campus. We still have a lot of work to do as far as self-esteem in not only females but males too. It's really hard for all of us sometimes to talk nice to ourselves, and I think that's something that Active Minds addresses very well. Next. And this is our biggest event of the year. We're getting ready for that this Thursday evening. It's the Take Back the Night Walk and Resource Fair. Last year we had over 200 people attend. And what it is to bring awareness of sexual assault, domestic violence, child abuse, and how to deal with that if you have been victimized, or how to help a friend, or how to get involved in some way of preventing them. And we provide the Clothesline Project, where we have been making T-shirts this semester to display there. We actually have another one tomorrow. And we found the last couple of years that sometimes people have never told anyone about what has happened to them, and that this T-shirt, as unbelievable as it can be, that it provides that first word that they say about this to anyone. And people have come up to me, and I've never talked about this, and they have made these T-shirts. And it's some kind of an outlet where it's a door that opens, and maybe at that point they're ready to come through. We do have a photo booth. Kids get in there and have a good time and get their pictures taken. We have attendance giveaways. This is one of our fundraisers as well to cover the cost of the T-shirts that we give away. Active Minds feeds everyone with our fundraising, and so this is a totally free event for everyone that comes. And we have a drum circle, and the event is also attended by resources from the community. That's one of the reasons we have it. And this year we have 26 tables that will be representing everyone from the prosecuting attorney's office to our local hospital to the 911 dispatch to ComTree to our local women's shelter to the Lions Club. We have some of the churches that are involved because we know people, we need to reach them at every point that they are. So we want to find every avenue possible to be there where they need us. Okay, next. And so this is our picture at the end of the night. You can see everyone was involved. We all had a good time. We did some of the Love is Louder posters, which we have been involved as well. We use Love is Louder in many of our events. And it's a good way to get that message out there. Despite what you're going through, that love is louder and that there is help. And I think Active Minds really helps us get that message out there. I know that when we do these events, if we're tabling, that more likely than not, I'm going to walk a student back to my office with me. And I've had Active Minds members bring students to me. And I think that our visibility has encouraged other people to send students to me. I am here for 32 hours a week. I have 5,500 students to reach. I don't even get 2% of them in my office. So I have to get out of the office. So I would encourage all of you, if you're in your office, you have some time, go have lunch, go take a stroll across campus. Just make yourself known, because people see your face, they're more likely to come and talk with you, because that word therapist, that word counselor, it has not so positive things in some people's minds. Maybe they've had some bad experiences, or they've seen TV, and I don't even have a couch in my office. I don't ask about ink blots. We just want people to come and talk about what's going on. Let's make a goal and to get some help, because people recover from mental illness And we have to remember that. They just need the avenue to get there. And I think that's all I have for you.
Thanks, Sandy. We have a few minutes left. I just want to remind our participants as we go into our question and answer portion that you're currently in listen-only mode. So if you have a question or a comment for our speakers with the remaining time, please use that Q&A button in the top left corner of the screen to send questions to the speakers. And with that, I'm going to start reading out some of our questions and referring them to our speakers. This first question is for our Healthy Minds Network team. Have you compared prevalence of heavy alcohol use or alcohol use disorders between community colleges and four-year colleges?
Hi. No, we haven't actually done that. We've pretty much only done what we showed you, but we will be looking at that very soon. So if you really are anxious to know, and it's certainly an interesting question, please feel free to email us, and we can get back to you pretty soon.
Thanks. This next question is for any of our speakers. Are you aware of any of the liability concerns with providing services to commuter colleges? If so, how are they overcome? Any of our speakers, either Becky or Sandy, may be aware of any liability concerns with providing mental health services on campus?
This is Becky. I think that as any higher education institution, we're guided by regulations in terms of confidentiality, and that I think maybe the largest challenge we have in terms of liability would be, just negotiating who the student's network is, and when something that comes up that might be a crisis situation, or I think the biggest challenge is the cases that seem to be right on the line in terms of whether or not there's a harm to self, others, or gravely endangered. And I think that case-by-case basis is how most of us, I think, approach any kind of issues like that. And to my knowledge, and in having done many of the trainings regarding threat assessment, as well as hearing from a wonderful legal consultant, I think clinical judgment trumps all. So that's kind of a motto that many of us go by.
Thanks, Becky. This question is for Sandy. Sandy, how do you balance working on an Active Minds chapter and being a counselor at your college? About how many hours do you dedicate each week to your Active Minds chapter, and about how big is your budget?
Well, balancing budgets and balancing time management. Two big questions for everybody. Well, time-wise, I'm here for 32 hours. I have students that I see as far as therapy. Our Active Minds meets once every month is how it goes. And so we do a lot of our stuff either on our Facebook page or by email. So things that need to be addressed, they can be quickly done that way. Let's see, in time management, we try to take care of it that way. The budget, our college provides a $500 beginning budget for organizations at the beginning of the year, and we use that to kind of spread the wealth. We do have some giveaways that we have. We have some get-togethers to kind of encourage our members, but the money it's used wisely. So we try to be very conscientious of how we use it so that the most benefit comes from it.
Great. One final question for any of our speakers. What mobile apps are you aware of that have been used for improving mental health?
Go ahead.
Oh, okay. I'll just say quickly, but I'm curious to hear your answer. That we at Michigan we're working on a new mobile app that involves brief videos, the Inkblots video series that we've been doing some research on. So that we're hoping will teach some simple coping skills and encourage help seeking in the context of mobile app, but that's still in the planning phase.
I think in terms of the California community colleges, there have been several colleges which we highlighted a little earlier that have developed their own apps that are specific to their own communities. And they've also been utilizing students to give them input on this, which I think is really an open window for us to really figure out what are the apps that are going to be the most utilized and most attractive for students to use. And I'm sorry that I can't answer that more specifically at this time.
This question, I would imagine, is for Sandy, but anyone is welcome to respond. This is from a student at a four-year university interested in raising participation in their mental health-related club on campus. And this participant is interested in any strategies you may have for increasing active participation among members of a student mental health group. So engaging our members in more activity.
Well, start off early. Try to have a plan of attack right at the beginning of school and be visible. Give your students permission to get out there and talk about it. We reserve the sidewalks a lot here. I know we don't just reserve rooms. We reserve sidewalks so we can be out there. We're either chalking or we're tabling. But try to get visible, and then have a list of the things that you're going to be doing so that people are like, oh, that looks like fun, or what's that about? I mean, you start talking about zombies and drugs and the other things that come along with mental health, and people are like, what? They want to know more. They want to get educated about it, and they want to be able to talk about it, and it's like Active Minds gives them permission to do so because everybody knows someone. We had 5 high schools in the last 2 years that had suicides in them. So you know those freshmen that are coming here, they're wanting to know what to do because they've already been devastated once. They want to do something to prevent it. So they're looking for that information, but they want it to be fun too, and so there's the balance, education and making it fun.
And I'll agree with Sandy on that and just speak as the chapter manager that many of our chapters at Active Minds use leadership roles in their Active Minds chapter to engage students by giving them responsibilities and delegating tasks to students, and they are accountable to not only being present at your events but bringing something to the table. And that actually engages them and makes them feel more like a member as well. One last question for any of our presenters. Have you created educational materials for a specific population? And if so, what types of materials have had the greatest impact?
I'll answer that. This is Becky. I think one of the things that I know that there are campuses that do create their own materials. I think given the few resources that we have and the little time that we have, we tend to, many of us have tended to look at materials that already exist because there's some really wonderful materials that already exist through the American College Health Association, through ETR, Education Training Research Associates. There are several other vendors, but and some of the time we actually do translation of those for Spanish-speaking and Chinese-speaking students here at City College. But because of the materials that are available, and again, sharing collaboratively among our regional stakeholders for county mental health and the other higher ed entities, we really have, I think, you know, I can't speak for all of my colleagues around the state, of course, but I think more of us are really leaning on one another to adapt things that already exist because there are some really good materials already there, and none of us have time to recreate the wheel, so to speak.
Thank you, Becky. And with that is all the time we have for our webinar today. I'll ask our attendees to please take a moment to complete our brief survey before closing your browser. Also, please look for a follow-up email that will provide the recording of today's webinar. If you enjoyed today's presentation and you're particularly interested in learning more about the Cognito Gatekeeper training, please stay tuned for another webinar from Active Minds coming soon. You can visit us at activeminds.org or email us at chapters@activeminds.org to stay connected and learn more about resources and information like this in the future. On behalf of the team at Active Minds, I would like to thank all of our presenters, Daniel Eisenberg, Sarah Lipson, Becky Pirelli, and Sandy Davis, for sharing their knowledge and expertise with us. Thank you to our attendees for joining us and taking time to view our presentation. Have a great day.